All right, everybody, welcome to our Experience, ASCP's podcast. I am your host, Chad Wers, and I'm alongside my co-host, Tom Hansel. And I am for sure very excited to have Synovia Moss. She is the CEO of Moss Consulting. She is somebody that I met on an advisory board in Paris, of all places. And I don't know how lightning kind of struck the two of us, but we sat next to each other, and then all of a sudden we were the two people making the most noise at the advisory board, and as Synovia will say, shaking things up a little bit.
Well, you weren't supposed to be drinking at this at the board.
We weren't actually. Okay. No, we weren't. Maybe it was the time difference. I don't know, but it was very exciting to meet Synovia and hear about the work that she was doing. We came back to the States, obviously, and I got to speak in front of one of the groups she works with, and you could just see a budding relationship with the kind of community and public health work that Synovia does and the work that our pharmacists do in older adult and medically complex patients. So, Synovia, I won't continue to talk. I want to hear. We always start these podcasts with the origin story. You're a healthcare superhero, so we want to hear the Synovia Moss origin story. How did you get here? Give us your background.
Well, I would say, first of all, thanks so much for having me, and what a pleasure for us to just have a conversation around things that we know that can better our world. So I'm Dr. Synovia Moss. I am a wife, a mother, a strategist, and a public health advocate, and I'm deeply committed to improving health outcomes and quality of life, particularly in African American communities. As you shared, I am the CEO and managing partner of Moss Consulting and Management Group, and we specialize in organizational change, strategic partnerships, and capacity building for nonprofits and community-based organizations. And so, as you shared, our consulting work allows me to bring evidence-based strategies and meet cool people like Chad and do the training and evaluation work all across the globe. And so I'm just excited to be here with you all.
That's awesome. So tell us about, where'd you go to school? Where'd you grow up? Like, how'd you get here? How did you get that appetite for that work?
What drew you to public health?
Well, believe it or not, I am a staunch sports advocate. And so I hail from Wisconsin, and I play volleyball at USC. I've always used that framework of sports and teamwork to do this work. And so from Milwaukee, ended up in California for 20 years. I ran a lot of programs in Los Angeles, and then some of those programs went national, and that's how I started the consulting work. And it's just been this confluence of wonderful opportunities that I think God opened up a lot of doors for me.
That's so awesome. I did not know that. I did not know that sports background. That's great.
I mean, you don't know that.
As my staff will tell you, I use a lot of sports analogies and a lot of coaching analogies and team analogies. Yes. So I love that.
Yes. Unfortunately, they're usually based on Cincinnati teams, and so it's about how to accept defeat.
They are. I guess that makes Synovia. I guess that means
on the record.
You're a Milwaukee sports. You're a Wisconsin sports fan.
Yes, Milwaukee Bucks, but I have the Lakers in me, so I've been
there you go.
Yeah, and I was there during the Kobe era, so it was just magical.
Oh my gosh, yeah, that's awesome.
Yeah.
So what? Tell us about what you're doing now, the groups you're working with, and what your focuses are.
So some of our major programs right now, I lead the Good Health Women's Immunization Network, or Good Health Wins Initiative. It's a collaborative effort supported by the National Council of Negro Women. And so we, during the COVID response, help with making sure that groups and organizations, those major state and national organizations, have the information and the knowledge to help us combat COVID. We have since broadened our role from COVID to vaccines across the lifespan. And so we continue to lead that work. So I work with about 1,000 or so different chapters and sections and national affiliates of the National Council of Negro Women to really work to build vaccine confidence, expand access to health information, and strengthen community partnerships.
What do you think from your experience that is the most deterrent part of not taking a vaccine? Do you think it's just lack of knowledge, or is there real fear out there? Is there governments lying to us, or just don't understand how vaccines work? What do you think when someone says, I'm not interested in that? What's really the cause of that, root cause of that?
I think people are all over the spectrum. And I'll give you an example. I've been doing this work, talking about the importance of vaccines the last 5 years, and my brother won't get vaccinated get the COVID vaccine. And what we're seeing as we do listening sessions across the country is that there are a variety of reasons. And so with Good Health Wins, we say we try to make space and grace that if you give people good information and you build community where they can trust you with that information, that they will, as your mother said, when you know better, you do better, that they will get a vaccine. So it's all over the map, seriously.
Yeah, it's interesting. Like when we had a grant with USA Boxing, and you were starting to engage people that might have been in a lower socioeconomic environment. There were the Hispanic population, the African American population. And when you went to their things, when you went to their event and you stood there as pharmacists just having conversations, you saw a lot of those barriers break down. People wanted to see that their colleagues were getting the vaccine or talking to somebody about the vaccine. That would make them talk about it. They might not get the vaccine at that clinic or at that event, but they probably got it later. Because they got the information that they needed. To me, that was my biggest learning of this, because we're ultimately in older adult medicine, we're about access. We want people to get whatever medication they need. We want them to have access. No closed doors, no, that's too expensive for you, all the stuff that we hear in our healthcare system. But one of those areas is just reaching people.
Right.
Yeah.
You've got to reach people
where they're at,
and you got to go where they're at, where they're comfortable, so that they can be comfortable talking about it and getting it. And I think that was a profound learning that we had, certainly from ASCP's perspective. But
have you experienced the same thing, Synovia?
I agree wholeheartedly. And so with the initiative Good Health Wins, we are in about 10,000 zip codes across the U.S. Wow. And so we offer mini grants to different chapters and sections of community-based organizations that have already been in communities. So they already have a relationship. And so, my passion is connecting people and resources and data in ways that empower the communities to take charge of their health and create sustainable change. And so it is meeting people where they are. It is a matter of making sure that we listen first and find out where that connection point is that will help someone to say, you may not understand this or you may not have this knowledge, but here is where the information resides, and go check it out for yourself, because we want to teach people how to fish for themselves so that they can be healthy all the time. And for us, our position has been making sure that people understand, especially around vaccines, that vaccines are a part of good health. So that's our position. So I agree with you as far as connecting with people and meeting them where they are.
Well, I love your space and grace. I'm going to steal that and use that, because that's how I feel like, that's what I feel like we were figuring out, is if we went to their space and we gave them grace and they gave us grace, like we could have those good conversations.
My teenage daughters tell me that all the time. You need to give me space and grace.
That's true. So what beyond did your groups work beyond vaccines into other aspects of health, or is it primarily focused on the vaccine piece?
So on this particular project, the National Council of Negro Women itself is an umbrella organization for 37 national women's organizations. So NCNW was founded 90 years ago. We're celebrating that December 5th. But 90 years ago, our founder had the vision to bring together and understood the importance of collaboration and collectivity and connectivity. So think about that, 90 years ago,
It's amazing.
bringing all of these folks together. And so we do that around health, we do that around social justice, we do that around education. So a lot of the groups that we work with some of them are over 100 years old.
Wow.
So this is not new to us. So that's why, at the onset of the pandemic, it was organizations like NCNW that the CDC came to because we were already positioned in communities. And so you saw that in the PAID program, you see that in the REACH program. So it was just a matter of coalescing the groups that were already on the ground doing the work.
That's great.
That's awesome.
So part of what, we hit it off on when we met was just this concept of making sure that our groups were aware of each other and as you point out, making those sort of connections. What do you think the different groups around the country, what are their pain points? Like, what do they need help with? Or how could our pharmacies connect with them and support them in ways that launch their mission further?
Well, I would say that community-based organizations, they need resources on the ground. They're the ones doing the work. And generally, especially during the pandemic, we saw that, what is it going to take to get the country to herd immunity? You got to give the funds to the people who are doing the work on the ground. But what does that look like? So they are, we have this thing where we call it Best of Show. And let me back up. Every first and third Thursday since the beginning of the pandemic, we have been convening our groups and organizations. We average almost 800 to 1,000 people every first and third Thursday since the beginning of the pandemic. So last week we just did Community of Practice 105. You hear me 105 times that we didn't miss, and we built community. And what we do with our community of practice is 4 steps. We activate, educate, motivate, and celebrate. You have to activate and really invite the groups in to do the work. Think about it. I mean, these groups have been doing health programs for 100 years, but nobody really was doing vaccines.
Yeah.
Right? The pandemic brought us into the space, So I think that, going forward, I hope we don't need another pandemic to say these groups are very valuable to public health.
100%.
We educate our folks. And so I always say for Good Health Wins, we keep it real and relevant. We talk about real things in real time and real questions, and we're not afraid to touch and dabble with anything that we hear in the news. And then, so really I would say my role is as a translational scientist. I take all this, all our acronyms that we have in public health, all of this stuff that's going on. And I said, let me break it down to you so that the average person can understand what we're doing. So then we educate. We just went over the 100,000 participant mark. So we know that people are very interested in having a safe space where they can talk about what's really going on. And then we really motivate because community-based organizations don't have the support systems that most organizations have. Mm-hmm. So if you think about it, if it is, think about it's like, if somebody at United Way started doing public health, how would they know about public health? So You have to educate that volunteer, but they're still a very valued person on the ground. And then we celebrate. We showcase the wonderful work that's being done across the country because I have never seen the amount of creativity that we have in our country around reaching people. And so we say in Good Health Wins to overlay vaccine confidence into what you were already doing. They were already distributing food baskets. So it's adding the adult or the children's schedule when you're doing food distribution. It is adding a QR code about where to get vaccines if you're doing a breast cancer walk. It is, we've had groups that did fishing for families, and while they're doing the orientation about taking the kids on the boat, they're talking to them about the importance of immunization. So it is that creative space that makes us this great America democracy in action. So that's a long answer to yes, this stuff
It's a great
works.
answer.
Okay.
Yeah.
I mean, and you could feel it in that meeting that I got to participate in. And again, I kind of like the way you frame things. Like, we talk about population health and we talk about people need to get vaccines. But when you talk to the people on the front line, when I was talking to your people in that room, they were talking about specific people. Like, this would be great. We need to do this for Mrs. Whoever. And I'm like, that they're making that last mile connection to an actual person. We like to talk about what we want to do for the population or big groups. Yeah. And then there's nothing wrong with that, but you got to get it down to the person that's actually going to maybe put the vaccine in the arm or give that piece of advice that changes their health outcome. So I love that about that. And I do feel like vaccines can be the conduit to future conversations about other things. And it may not be a pandemic, but we all deal with Alzheimer's, dementia, and those issues as we get older. That may become a conduit for, well, how do we talk about that? How do we help these people that are becoming caregivers now, and they may not even understand what their grandma or grandfather or parents are going through?
That's a good point.
Or you might be talking to the parents or the grandparents about things that their spouse or their partner is going through. So I just think the work that you guys do is amazing. Like, it is frontline.
I'll tell you some interesting things that we do. So, you think about, like you say, vaccines is an entry point to talk about public health. But as we were growing and doing our community of practices, things would come up, like they would say, what's the intersection of vaccines and heart health, or vaccines and diabetes, and vaccines and hypertension? And so we would go out and find the specialists to talk about that. I'll never forget, we finally got a African-American cardiologist to join us, and he's in his car on the Zoom. We're saying, please be safe, sir. But he's in the car on the Zoom. And if that wasn't the best connection, because they were like, wow, this man really cares about us enough that get on this call and talk to us. And so imagine the cardiologist is in this car talking about heart health and vaccines. And it was like, wow, that was really good. Or we have a resident physician who specializes in obesity. Now, every time she comes on, everybody pays attention because everybody feels a little bit of obesity, Yep. And so it's not just vaccines isolated, it is dealing with the whole health of a person. And Chad, I would say that when we met, it was instant, because I kept saying, wait, you're a missing part of our formula, because the pharmacists play such a critical role, as we all know, during COVID. But in a lot of our communities, and especially communities of color, the pharmacist is the key physician or that key person to get health information. So that's why I said, we're going to be joined at the hip. We are forever together. So.
Well, it's exciting to think about that from my perspective, because our pharmacists yearn for that kind of connection to their communities. So being able to make that handoff or create that connection, I think that's what we do. That's our job. Like, it's fun.
That kind of falls in line with my next question is, like, what's the future look like? What do you guys, any things that you're rolling out, any big plans or projects? And then obviously, how can our team, ASCP, and our members actively help you?
Well, I will say that Good Health Wins continues to grow, and our goal is to continue to scale it. Currently, we're in 40 states and 40 national organizations. We have a reach to about 4.5 million. And so it is going to be important for us to put these partnerships in place so that it's longstanding. And that's the one thing about Good Health Wins, is that we look for long-term partners who are going to stay with these communities. Think about it. We have 4 people who have been on all 105 community of practices.
That's awesome.
So if you think about that, I'm thinking, wow, we've been together for 5 years, and I'm talking about They will call when they're on vacation so that they don't miss. I mean, the level of commitment in our community is very strong. And if you can partner that with organizations like yours, and we talk about what is the role of the pharmacist, we can direct our folks to say, we know you're going to your pharmacist. We don't care where you get good health information. Just make sure it's a credible source. And people trust their pharmacists. They really do.
Yeah.
And so I think that where do we go from here? The sky is the limit, because I think that what we've created is a roadmap of how we get to community. Yep. And how we are able to have these, like you say, deep conversations. But at the end of the day, this is all about trust. Who are you going to trust? And when you trust people, so like you trust your family members, you trust your sorority members or your fraternity members, you trust people who you go to church with because they're known to you. And so just by that staying power, I think that is half of the battle as well. So, we just are excited about the continued partnership with you all.
Yeah, we talked a lot about trust through this whole COVID piece, and it's clear that at the national level, the public lost a lot of faith in the Surgeon General, the people at the top of the government, but they didn't lose the trust in the person that they saw once a week or once a month in their community, that was either a nurse or a physician or a pharmacist. And that became the goal, was make sure that the person at the front line was knowledgeable, because that's the person that people in the community are going to trust. They're not going to trust, Dr. Fauci per se, but they will trust the local pharmacist or the local physician. So let's get them everything they need so that they can empower their communities. So our goal needs to be, I need every chapter leader to have the cell phone of a pharmacist in their area working together on stuff like this, because I think that would be a great goal for the next year and really amplify how both individuals in their communities can improve the health of the people that they serve. So it's exciting.
And I'm happy to send information to you all so that you all can join the Good Health Wins Network, because it is something that you have to experience. I tell you, think about having 800 to 1,000 people on a call at one time. And we can do things that we are really taking advantage of, having this large cohort of folks together. So we do pulse surveys where we want to know in real time, how are you feeling about specific topics? We ask them in real time, what are your challenges or your barriers? Because you all know that the information changes so quickly. So we want them to understand, here are the changes. 1 year we have the Bridge Access Program. Next year, 3 months later, it's gone. So we still have that issue of what do we do with uninsured and underinsured. So instead of getting caught in, I call it the swirl, don't get caught up in the swirl, right? Just stand still and let's figure out, what do we really need to talk about? We don't have to get into the change of all the administrations, right? Yep, a lot of people talk about that. And I said, hey, folks, let me give you a reality check. Our vaccine numbers were low before the Trump administration, before the Biden administration, before the Obama administration. You all see what I'm saying? Yep. So we said, let's be honest about, this is an issue in our community that preceded all of this. Right. So you don't have to get caught up in this world. Let's figure out what our real solution is going to be in making sure that children and adults get vaccinated across the lifespan, right? So with us being a women's organization, we can say, look, this shingles thing is real. Yeah. You don't want to get shingles, or, and we talk to them about HPV and starting that conversation at 9. And there are a lot of things that we don't shy away from, because we know that it's going to help our community.
Absolutely. Well, this has been awesome. You're absolutely a rock star. I feel like every time we talk, like, we're instantly back in that conference room in Paris and figuring out how we're going to save the world.
Yes.
One injection at a time.
One injection at a time. One piece of health information at a time. Whatever it takes.
That's good.
You were awesome. Thank you so much for being on our
Thank
podcast.
you.
Any last words, Tom?
No, once again, I'm learning the most. I benefit the most from these conversations because I learn. So thank you so much. It's great and
Thank
very
you.
inspiring.
Yep, and we'll definitely connect and get our members connected to your members.
And we'll spotlight the podcast on our community of practice as
I
well,
love it.
so that people know about the work that you all are doing. And thank you for being on the front lines as well.
Thank you. All right. Thank you so much. Thanks to everybody for listening and watching. We'll catch you next time on Our Experience.